Now, we as a practice decided to conduct a clinical investigation, which really had not been done before, comparing these two types of garments. So we asked several questions. Are there differences in how patients perceive the comfort and wearability of compression garments after liposuction? How important is the type of fabric used? Do different garments result in different levels of patient satisfaction and compliance? And here's what we did. Over the course of 9 months, we as a group of 5 plastic surgeons enrolled volunteer patients into the study. A total of 50 patients were enrolled over 9 months who had liposuction of the abdomen and thighs, and an additional 40% had other minor areas of liposuction. All patients had their surgeries in our surgical facility under general anesthesia, and they stayed for a period of 23 hours. We specifically selected patients in a very tight group, meaning that they had to be between the ages of 17 and 39, with a mean of 32 years of age. Their weight had to be between 138 and 170 pounds, with a mean of 159 pounds. And they had to be able to fit comfortably in a size large garment with these measurements. And the patients needed to be willing to use the garments continuously, using a full body garment below the knees with suspenders. Each patient received 2 garments. One, which we referred to as the experimental garment, was a black garment, and this was the ComfortWeave fabric, donated by the Marena Company. And the other was the control, which was the standard PowerNet fabric designed by Design Veronique, which was beige color. The patients did not know which garment was made of which material. And here you see the patients in the 2 different garments. And you see that they basically had the same body areas covered. The patients were told that they had to change their garments every 24 hours and that they had to do this for a period of 4 weeks. We registered the patients. We obtained informed consents in all of them. Photographs were performed on each patient, as we generally do for patients who come in for these operations. And we followed them with operative visits, or post-operative visits, I should say, and with telephone interviews. One important component of the study was that the patients were given a questionnaire containing 35 items. I want to mention again that the Marena Group provided the experimental garment, and my group the control garment. The questionnaire consisted of making the judgment based on this rating scale of 1 to 5, where 1 meant that you strongly disagreed and 5 that you strongly agreed. And these are the 35 questions. And purposefully, the questions were made redundant so that we could make sure that patient answers were consistent. And these included such questions as, the garment felt soft, the garment stretched adequately, the garment supported me enough, and so on. In a separate category, which we refer to as comfort and healing categories, we also asked patients questions such as, the garment cooled my skin, the garment was easy to put on or take off, the garment reduced my swelling. When I wore it, the garment reduced pain and swelling when I wore it, and so on. And additional questions related to garment care and aesthetics, such as the garment resisted staining or was easy to clean, smelled fresh, or developed an unpleasant odor. And then we asked them to rate the garments overall so that they had a choice to pick the beige garment, the black garment, neither one. And then the last question related to if they could choose one garment to wear only, which one would it be, the black or the beige? And here are the results. I mentioned to you that the questionnaire was made redundant so that we could make sure that patients' answers were consistent. And we found that in 94% of the cases, these answers were consistent 100% of the time. So our results we found to be very accurate. The three most important factors that patients reported when selecting a garment was comfort, support, and softness. We found out that the control garment, which was the Marena garment, that the control garment, which was the standard garment, the garment that we've used for many years, produced more irritation, was more itchy, and harsher against the skin. And patients, in 82% of the cases, preferred the experimental garment, the ComfortWeave garment, over the PowerNet garment. And they found that the experimental garment made of this ComfortWeave fabric was softer, more conforming to their bodies, more comfortable and easy to wear. Specifically, we looked at different categories of responses, and we found that the experimental garment was better at keeping the patients cool, better at ease of putting on and taking off, better at reducing pain and itching, and more comfortable to wear over long periods of time, and was as good as the control garment in reducing swelling, keeping the patients dry, helping with bruising, etc. In no category did we find that the experimental garment performed worse. In terms of softness, we found an overwhelming support for the experimental garment, such that with statistical significance, the experimental garment was preferred in terms of softness. And here you see the data reflecting that. Here are their conclusions. The results obtained reflected a significant increase in patient satisfaction and compliance. When given the choice to select the experimental garment, which was the ComfortWeave, over the standard garment, which was the PowerNet garment. And we found that there is a significant difference in comfort between these two fabrics and satisfaction in the postoperative period. I want to mention that the experimental garment is available in Israel, and you can certainly ask questions of the distributor, which is BodyTech. And I want to thank you, and thank you for the opportunity of presenting this information to you. Shalom lekulam.